Okay, I want you to pay attention to this. Imagine if you aren't an African-American woman, whatever you are, if this was happening to someone who looked like you. All right, a new study conducted in 10 cities across the U.S. has found that the HIV rates for black women are actually much higher than previously estimated, 5 times higher than numbers reported by the Centers for Disease Control and Prevention. Joining me now to talk about it is the study investigator, Dr. Carlos Del Rio. Thank you so much for joining us. I think this is a very important study. So first, tell me why you think this study is so important. How did you choose the women, and what does it show to you?
Don, I think that the study is important because we have had a lot of difficulty understanding why African-American women have such a higher risk of HIV infection compared to white women. There's about a 15-fold higher risk for African-American women compared to white women. And in this country, about 25% of new infections every year occur in women, yet understanding why that racial and ethnic disparity exists has not been clear. What the study has done is has recruited women in 10 communities at high risk of HIV and has looked at what happened to them. And we found several things. And one of the most important findings of the study is, I think, that what puts this woman at risk are the associated factors. It's substance abuse, it's poverty, is poor income. It's a series of factors that you and I know are more common in African Americans. So again, it's not that they get HIV because they're African American. It's all those other factors that simply confound it and make it very, very hard for them to avoid HIV infection.
Okay, so African American women are at the top of the list, especially when it comes to new infection rates. I think they're highest, right? Among African-American women. Okay, already. So how did you choose the specific cities, and why not big cities, like why not LA or Chicago or something like that?
Well, it's based on data that CDC has of areas that we know there's a higher proportion of HIV infections occurring in women, and it's primarily in the cities in the eastern United States where we see a higher rate of women. The epidemic in some other cities, for example in San Francisco, is primarily among gay men. So I think these are the cities that were chosen for a variety of reasons, but most importantly is because they're some of the most affected areas of the country for women. I think an important topic to also remember is that, ironically, yesterday was also Women and Girls HIV Awareness Day. And I think it really highlights the importance that we need to put in trying to get prevention. There's a new campaign, Take Charge, Take the Test. We really need to encourage African-American women that the first step is to know your status. You got to know if you're infected or not. If you're infected, you got to get into care. We found 32 women during the study enrollment period who were HIV infected, lived in these communities with a lot of risk of HIV, yet didn't know it.
Okay.
And then if they're HIV negative, they got to use prevention.
All right, Doctor, I want to ask you a couple of things, if you really quickly here, because we don't have a lot of time. You mentioned it was because of lifestyle. You said because of drug users or what have you. Does it have anything to do with dating men who are not revealing their statuses and not revealing that they're gay, or does that all factor into that?
It probably does, and probably does because there's also higher rates of infection in men in those communities, and many of these women, almost 40% of these women said they had unprotected sex with men who they didn't know their HIV status, and that, of course, plays into this.
Yeah, and you said that you found the numbers of HIV in these cities were comparable with parts of sub-Saharan Africa, which has been ravaged by HIV/AIDS, and in places that have less information than the United States.
And we're right here in the District of Columbia in D.C., and D.C. is, again, a city. If D.C. was a country in Africa, it would be one of the most affected countries in the world. I think one message also out of the study is that the epidemic in the U.S. is not gone. It's here, but it's primarily affecting a forgotten population, the poor and the ones we're not really paying much attention to. And we really need to do renewed efforts as the as the AIDS conference is happening in July here to really confront the epidemic.
Okay, yes, Doctor, that's gonna be big. And I have to go, but I have to ask you, does stigma in the African American community have anything to do with it? Does that contribute to this?
Stigma has always had something to do with the HIV epidemic, and I think is one of the most difficult things to deal with.
Dr. Carlos Del Rio, an important study. We appreciate you joining us here on CNN. Thank you.
Thank you so much.